Welcome back to the Deep Dive. Today we are strapping in for an exploration into a field where the ancient commitment of human compassion is intersecting with the cold, staggering power of modern data processing. We're talking artificial intelligence in healthcare.
Yeah, it's a huge topic.
It really is.
Yeah.
And this isn't just some future concept, right? It's a rapidly accelerating reality. It's forcing us to redefine what medicine looks like, on the front lines in rural clinics and even in our ethical frameworks. Our sources for this deep dive are particularly sharp, I think, largely drawn from the visionary work surrounding the AI in healthcare, healing algorithms and ethics framework. People like Mr. Zahir Ahmad Mir are really pushing this.
It's compelling work.
These sources challenge us to look beyond the hype, and see the immediate life-altering impact of this technology right now. Okay, let's unpack this, starting with the central provocative questions that are really driving this whole revolution. What if machines could detect critical disease indicators like malignancies or chronic failure before symptoms even fully appear?
Imagine that.
Right. And what if this meant hospitals could operate faster, doctors could decide wiser, and patients were met not by sort of administrative fatigue, but by focused, empathetic care? We're officially entering, I think, the age of the healing algorithm.
What's fascinating here is that the source material doesn't just focus on the tech, the engineering side of things. It really addresses the dual challenge of this entire transformation.
Which is?
Well, on one hand, you have the aggressive acceleration of technology, yes, but on the other, there's the mandatory humanization of ethics that must accompany it. Our mission today is clear. We're going to analyze the 5 core areas where AI is fundamentally restructuring global medicine.
5 core areas. Okay.
Yeah, we'll be looking at the immediate, tangible benefits, from diagnostics to documentation, but also diving deep into the absolute necessity of establishing robust, ethical, and importantly, localized standards for global patient care.
Localized standards, that's key.
It is, because this isn't just about rendering faster CT scans, it's about reshaping the entire contract between doctor, technology, and patient.
Right. And to truly understand the stakes here, we need to move past the abstract idea of AI and ground ourselves immediately in a real compelling story. The kind of pivotal moment that really makes this technology feel, indispensable.
A concrete example always helps.
Exactly. So let's set the scene, as described in our source material. Picture this. Shakakanum Hospital in Lahore, Pakistan. You've got this vast digital queue of radiology images, thousands of chest x-rays, MRIs, CT scans, just pouring in from across the region.
An overwhelming amount of data.
Totally. A data set just too massive for any single human radiologist to process with, total reliability in a single shift, especially under intense time pressure.
Right. The fatigue factor alone is significant. So the hospital deployed an advanced AI model. This is a type of deep learning network, and it's been specifically trained on millions of previous medical images. Its job, spotting subtle, potentially malignant anomalies.
And it works tirelessly.
Tirelessly. Overnight, this system is scanning, analyzing patterns, picking up on discrepancies that might be invisible or just, frankly, too numerous for a fatigued human eye to reliably catch in that sheer volume.
So the next morning comes, the review happens, and the system hasn't just categorized images.
No, it had raised a massive non-negotiable red flag.
A red flag.
That's the pivot point. The system alerted the attending doctors to exactly 17 patients who are showing clear, early radiological signs of developing lung cancer.
17.
And critically, these were signs that hadn't yet been formally flagged by the human review queue, which was, still working through that backlog.
Wow. Okay, just think about the profound clinical implication of those 17 alerts. For those individuals, those families, AI didn't just serve as some predictive tool. It delivered something infinitely more valuable.
Time.
Exactly. It moved potential treatment, chemotherapy, surgery, radiation, potentially years earlier in the disease cycle.
Which is crucial, because earlier treatment often means lower toxicity, less invasive protocols, and most importantly, dramatically better survivorship outcomes.
Right. It's life-changing, potentially life-saving.
The significance here is, I think, twofold. First, it just perfectly demonstrates the superior pattern recognition and, frankly, the endurance of the machine. It doesn't get tired.
No breaks needed.
No breaks. And second, perhaps more importantly, it sets a profound tone for how we must view AI as a life-saving tool that is now fully integrated into and actively elevating the precision of the front line of clinical practice. It's not sci-fi anymore.
Not at all. It's here. So building right on that initial anecdote, when we look at the immediate practical applications of AI in a busy clinical environment, well, the sources show us it's already functioning as the doctor's most indispensable assistant.
That's a good way to put it. Assistant, not replacement.
Precisely. This isn't about replacing doctors. It's about giving them essentially superhuman capacity for acceleration and precision. So the first and probably the most widely adopted key application is image recognition. To get slightly technical for just a moment here.
Go for it.
These are often convolutional neural networks, CNNs. They're trained on these vast data sets of successful diagnoses, right?
Mm-hmm.
They allow AI to perform incredibly complex pattern matching on medical images.
And why does this matter? Because while a human radiologist, brilliant as they are, must rely on training, experience, and, let's be honest, energy levels.
Which fluctuate.
Of course, the AI model applies the exact same flawless statistical criteria to the millionth image as it did to the first. The precision is paramount. We're talking real-time assistance here.
Like what specifically?
Okay, so detecting microscopic malignant tumors in really complex MRI sequences,
Right.
or rapidly identifying hairline fractures in trauma situations where every second counts. Even spotting minute heart defects in pediatric cardiology, things that might be missed in early fetal scans. Integrating this tech into the imaging pipeline radically shortens that diagnostic timeline. Patients move from scan to treatment strategy much, much faster.
And that speed. It's not just about reading images, is it? It's also critical in managing the flow of actual human beings. I'm thinking emergency triage.
Oh, absolutely critical there. Picture a chaotic, high-stakes emergency room. The triage nurse has this almost impossible task, right? Quickly assessing multiple incoming traumas, trying to prioritize the most acute cases, while also ensuring lower priority patients don't suddenly deteriorate unnoticed.
It sounds like a perfect storm for human error fatigue, immense pressure, incomplete initial data.
It is, and AI can help remove some of that variability.
Right.
By analyzing initial intake data, everything from vital signs, reported symptoms, maybe even historical health records if available, the system can instantly flag patients who are at the highest immediate risk of mortality, risk of rapid deterioration.
So it helps cut through the noise.
Exactly. And AI can prioritize cases faster and arguably more objectively than any single human staff member juggling multiple traumas, ringing phones, worried families. This capability saves critical minutes.
Minutes that matter.
Minutes that mean the difference between getting the person having a silent stroke or an aortic tear to the operating room immediately versus them waiting behind a less urgent case, like a simple fracture. That's the difference between a good outcome and potentially a catastrophic one.
Right. But this assistant role, it isn't solely about these high-stakes diagnoses, is it? The sources also point specifically to AI's role in reducing something else that really plagues modern medicine.
Ah, yes. The administrative friction.
Doctor burnout.
Exactly. Easing the documentation burden.
And that documentation burden is, as you said, it's a silent killer of physician efficiency and morale. It's huge. Think about a typical clinical day. A doctor might spend 20 minutes maybe face-to-face with a patient, doing the exam, making clinical decisions.
Important stuff. The core stuff. And then they have to spend often hours after the clinic closes manually inputting detailed, often repetitive notes into electronic health records, making sure they meet complex billing and legal criteria. It's cognitive labor that pulls them away from actual patient care.
And just drains their mental energy.
Absolutely. So the AI solution cited by the sources here is pretty revolutionary. Specifically, advanced speech-to-text functionality combined with medical natural language processing.
So, like voice recognition, but smarter.
Much smarter. These tools can convert the doctor's spoken notes, their clinical reasoning, their observational narrative, convert it all into digital records instantly and accurately. They can even structure the information into the required standardized formats for billing, for record keeping.
So the doctor could basically do the consultation and the documentation almost concurrently or right afterwards just by talking naturally.
Precisely. And this shift frees up vast chunks of time. It liberates human doctors to focus on the essential human element, that direct patient interaction, maybe deeper analytical reasoning on complex, non-standard cases, and ultimately minimizing that administrative friction that really does lead to burnout.
And when physicians are less stressed, spending less time fighting with a keyboard and more time truly engaging with the person in front of them, what happens to the quality of that encounter?
That's the critical question, isn't it? How does minimizing physician burnout fundamentally and directly affect compassion? It allows the doctor, ideally, to reinvest that saved time and mental capacity back into the art of medicine, enhancing the overall quality and humanity of the care delivered. It's a systemic improvement, really. It benefits everyone.
Okay, so if Section 1 was about AI helping doctors diagnose and treat current conditions faster, Section 2 feels like, well, the real paradigm shift, transitioning to a model where we predict and maybe even intercept future risks.
Exactly. Moving from reactive medicine, treating sickness after it hits, to proactive, personalized, preventive health. It's a massive change in philosophy.
The core mechanism driving this transformation is the predictive power of machine learning algorithms, right?
Yeah.
We're moving beyond just looking at past data. How does this actually work in practice?
Well, these systems integrate massive, incredibly diverse data points simultaneously. We're talking genetic markers, longitudinal dietary history from years back, ongoing lifestyle data streaming in from wearables, social determinants of health like where you live, your access to resources, even localized environmental factors like air quality.
It's a lot of data points.
It's data volumes and dimensional complexity far, far beyond human capacity to synthesize effectively. I mean, a human doctor might skillfully juggle, what, a dozen key data points to make a reasoned diagnosis?
Maybe on a good day.
Right. An advanced machine learning risk stratification model can synthesize thousands of variables in real time, and it can calculate a personalized risk score for a specific illness, let's say cardiovascular disease, maybe 5, even 10 years into the future.
Okay, let me try an analogy here, tying back to our show. Think of all the disparate sources we gather for a deep dive like this one. You've got technical papers, personal notes, maybe some political analysis, anecdotal evidence.
A whole stack of stuff.
A whole stack. Individually, they're just scattered facts, really. But when we apply the analytical engine of the deep dive, we try to turn those disorganized, vast data points into a clear, cohesive forecast of a topic.
Makes sense.
Machine learning seems to do the same thing with health data. It turns all these disorganized, heterogeneous data points into a clear, statistically verifiable forecast of individual risk.
That's a good way to visualize it. And that forecast, importantly, is only truly valuable if it's dynamic and continuously updated. Which brings us to the absolutely critical role of continuous data monitoring.
Ah, the wearables.
The wearables, yes, but also other sources. What fuels personalized prevention is this constant granular data stream that essentially never sleeps. The sources really emphasize the rapid evolution of wearable sensors. These aren't just, novelty gadgets tracking your steps anymore. They're becoming sophisticated, sometimes medical-grade devices.
What kind of data are we talking about?
Continuous, real-time physiological data fed back to the predictive models. Everything from subtle changes in heart rate variability, which is a key indicator of stress and cardiac health, to granular sleep stages, core body temperature fluctuations, continuous blood glucose levels for diabetics. It's incredibly detailed.
Okay, that seems like an amazing amount of immediate surveillance. But doesn't this hyper-personalization inherently risk creating massive health disparities? I mean, where only those who can afford the high-end wearables and constant connectivity truly benefit from this revolutionary prevention?
That is a critical question, and it's one the sources absolutely address head-on. They stress that this technological acceleration must be balanced with accessibility strategies. It's a huge ethical consideration.
Okay.
But for those who do have access currently, the immediate outcome is radical. The AI creates this immediate dynamic safety net. If an individual's personalized data profile deviates even slightly from its established norm, say, a subtle shift in cardiac rhythm that wouldn't normally trigger an alarm, or an unusual spike in resting heart rate that wouldn't warrant an immediate hospital visit,
The system flags it.
the system provides an early warning. And crucially, that warning is usually paired with the proactive, tailored intervention recommendation.
Like what?
Like adjust your medication dosage slightly, maybe change the type of exercise you're doing for the next week, or prioritize a specific dietary shift. Small tweaks based on real-time data.
Here's where it gets really interesting. Because personalized prevention is, as you said earlier, kind of the holy grail of health management. The AI moves beyond just generalized public health advice.
Exactly. Prevention is no longer generic, the usual eat healthy, exercise more. it becomes actionable and incredibly specific to you.
How so?
The AI tells you, based on your unique genetics, your specific metabolic profile, and your current longitudinal data stream, that your specific lifestyle choices are elevating your personalized risk of, say, condition X by 30% over the next 2 years. But crucially, it then recommends these 3 specific, tailored interventions that have the highest statistical probability of mitigating that specific risk for you.
Wow. It effectively turns abstract public health policy into a concrete, minute-by-minute, individual health strategy.
That's precisely it. And that potentially shifts the entire financial and structural focus of the healthcare system. Instead of waiting for the expensive, late-stage crisis management of chronic diseases, treating the heart attack after it happens, for example.
Which costs a fortune.
A fortune. The system is incentivized to invest in early, much more affordable interception years before the crisis point. This maximizes healthy longevity for the individual and could dramatically reduce systemic costs overall. It's about leveraging AI to achieve health equity by optimizing individual outcomes, ideally for everyone.
Okay, so moving from the individual level to the bigger global challenge, one of the most urgent crises our sources address is healthcare accessibility. The reality is pretty stark, isn't it? Billions of people worldwide live in what are accurately called medical deserts.
It's a huge problem. Remote or underserved areas that lack basic diagnostic infrastructure, they don't have specialty care, sometimes not even consistent access to general practitioners.
And the sheer distance, the infrastructure limitations. It often makes travel to a specialist, maybe a dermatologist or a complex cancer specialist, just insurmountable for many people, which means treatable conditions can become fatal ones.
Simply because of geography.
Exactly. And AI, according to our material, offers a potential structural solution to this geographic inequity.
It provides pathways to essentially bypass some of these traditional structural barriers. The sources detail 2 primary scalable solutions for shrinking these medical deserts. The first involves implementing tele-AI platforms.
Which is more than just a video call.
Oh yes, much more. These platforms enable remote diagnosis. Imagine a patient in a very basic rural clinic, maybe hundreds of miles from the nearest city center. They can use a relatively simple setup, maybe even just a smartphone with a good camera, to capture high-resolution diagnostic data.
Like what kind of data?
Could be a specific blood smear image, a basic X-ray, maybe a detailed photograph of a skin lesion. That data is transmitted digitally. An AI model analyzes it instantly, providing an initial diagnostic assessment or a triage level. Is this urgent? Is it likely benign?
And then a human checks it.
Exactly. That assessment is then typically backed up, if necessary, by a remote human specialist who reviews the AI findings, confirms or refines the diagnosis, and recommends next steps. It essentially brings the specialist's expertise to the rural patient instead of forcing the patient to undertake a difficult, often impossible journey.
That speed and access is vital. What's the second solution?
The second key solution is the implementation of accessible, often multilingual chatbots. These can provide 247 first-level medical advice. Now, to be clear, they absolutely do not replace a physician.
Right. Important caveat.
Very important. But they can handle an enormous volume of basic inquiries. Things like distinguishing between symptoms of a common cold versus potential flu, helping a concerned parent assess whether a child's fever warrants an immediate emergency room visit, or providing basic guidance on managing common issues like dehydration.
So it sort of democratizes those initial steps in the diagnostic pathway, makes basic info available to everyone.
Precisely. The outcome emphasized in the sources is profound. This dual approach actively shrinks medical deserts. It helps ensure that basic, triage-level medical guidance is always available, regardless of local infrastructure or population density.
But, expanding access isn't just about importing technology developed elsewhere, right? This brings us to a crucial point, the sources spotlight, the strategic necessity of leveraging local realities, building indigenous solutions tailored to specific populations.
Yes, this is fundamental. Our material highlights the potential within regions like Pakistan for this exact reason.
Okay, so why is building indigenous models so critical? Why can't we just take a model trained on data from, say, New York or London and just drop it into a clinic in Lahore or Karachi? Seems efficient.
Well, it might seem efficient, but it's actually a recipe for potential disaster. It comes down to data bias and relevance. The sources note that Pakistan, for example, possesses 2 major strategic assets here. First, Vast amounts of medical data specific to its own unique population.
Data that reflects local health issues.
Exactly. And second, a large, highly skilled youth population capable of innovation, coding, building these systems. The goal is to utilize these strengths to build indigenous AI diagnostic models.
And the necessity for that, it's rooted in what? Genetics, environment.
All of the above. It's rooted in epidemiology and genetics. Disease prevalence varies, dietary habits are different. Genetic predispositions, think about variations in cardiovascular markers. Specific types of diabetes common in South Asia versus Europe, they differ significantly. Even localized environmental factors matter.
So a Western model might just miss things.
It might completely miss critical, subtle nuances required for identifying diseases common in that specific region. Maybe certain inherited blood disorders or infections related to the regional climate. Building models rooted in local realities maximizes accuracy, relevance, and ultimately patient safety for the local population being served.
Okay, that makes perfect sense. And there's a really compelling practical example of this kind of transformation underway that ties this whole strategy together, isn't there? The Digital Future Health Tech Project.
Yes, this project really embodies the vision that people like Mr. Zahir Ahmad Mir and others in the region are pushing for. It aims to develop an AI-based screening platform specifically designed for decentralized use in rural clinics.
And the thing that stands out to me is the sheer simplicity and power of its diagnostic capability. Our sources say it can detect anemia and malnutrition from, what was it, a single image?
A single image. That is the ultimate demonstration of scaled accessibility. Think about the infrastructure this eliminates. In a typical rural setting, diagnosing anemia and malnutrition requires expensive, centralized laboratory equipment, specialized chemical reagents, highly trained technicians.
Things that often just aren't there.
Exactly, they're often completely absent. By utilizing AI to analyze a simple image, maybe of the inside of the eyelid or the nail beds, captured likely with just a basic mobile device, the system can instantly analyze things like blood saturation indicators, tissue color, texture, and provide a provisional diagnosis for two of the most pervasive, debilitating health issues affecting vulnerable populations globally.
It's a systemic game changer. It bypasses the need for labs in some cases.
It really is. This example synthesizes the full promise of these healing algorithms. It shows that AI isn't merely a tool for incremental improvement in the treatment of the affluent in wealthy countries. It is a profound tool for systemic transformation, driving fundamental health equity by leveraging locally developed technology to reach the most vulnerable, achieving diagnosis where none was realistically possible before.
But, as we celebrate the speed of this technology and the expansion of its reach, the question of data handling, patient trust, that becomes the absolute non-negotiable prerequisite for AI adoption, doesn't it?
Absolutely. You can't have one without the other.
The sources are really clear on defining the critical ethical backbone required here. They remind us that with great diagnostic power comes great constant responsibility. And the core principle articulated in our sources is striking. It really made me pause. Health data is described as sacred. That's not typical regulatory jargon.
No, it's not. And I agree, the use of the word sacred is deliberate and powerful. It underscores that this data is intrinsically linked to personal autonomy, to our very selves. And its misuse can have catastrophic, potentially fatal consequences.
We're not just talking about privacy breaches leading to, targeted advertising for remedies.
No, not at all. This is about algorithmic bias potentially leading to misdiagnosis because the algorithm wasn't trained on data like yours, or denial of insurance coverage based on a predicted risk score, or even systemic discrimination in treatment pathways.
The stakes are incredibly high.
Immense. If an AI system is trained on biased, incomplete, or flawed data, the consequences for the individual patient, particularly those from already marginalized groups, can be truly disastrous. This reality just underscores the absolute necessity of robust protective frameworks.
Because without that trust,
without genuine patient trust that their most sensitive information is protected and used appropriately, the entire system collapses. That continuous data flow we talked about earlier, the fuel for personalization and prevention, it dries up. Trust is the absolute currency of the AI healthcare revolution.
So to maintain that public trust and ensure the integrity of the data stream, our sources analyze the required operational standards. They define 3 ethical non-negotiables that must be met by any system before it gets deployed.
That's right, 3 pillars. The first is consent. And this has to go far beyond just clicking a checkbox on some long digital form nobody reads.
Right. Real informed consent.
Exactly. Patients must not only agree to the use of their data, they must fundamentally understand how it's being used. For what purposes is it for their immediate diagnosis? Is it for broader research? Is it potentially for profit? And who exactly is using it? This needs to be informed, intelligible, easy to understand, and perhaps most importantly, ongoing consent.
Ongoing. Meaning you can change your mind.
Precisely. Ensuring patient autonomy remains central, allowing them to revoke access if conditions change or they simply change their mind.
Okay, that's consent. What's the second non-negotiable? It tackles the technical complexity, right? Transparency.
Yes,
Wow.
transparency. This directly addresses what's often called the black box problem in AI.
The black box.
Yeah. When an advanced algorithm processes millions of data points, it often arrives at a decision, a diagnosis, a risk score. But the specific pathway, the reasoning behind that decision can be opaque, sometimes even to its own developers. Why did the AI suggest this specific diagnosis of a rare disease over a far more common alternative in this particular case?
We need to know why.
You mean to know why? Transparency requires that the AI system, or at least the clinical interface the doctor uses, can provide a clear, understandable rationale. It needs to allow human clinicians to trace the logic, to see the key factors the AI weighed.
Why is that so essential?
Because it ensures accountability. It allows human doctors to critically assess the AI's recommendation rather than just blindly following a mysterious, statistically powerful pronouncement. The doctor must remain the ultimate authority, the final decision maker, and transparency gives them the tools they need to fulfill that crucial role responsibly.
Makes sense. And the third, non-negotiable. This supports both privacy and the need for large data sets, right? Data anonymization.
Absolutely vital. Look, we need massive aggregated population-level information for these machine learning models to effectively train, learn, and improve their predictive power. We can't sacrifice that learning potential if we want the tech to get better.
But we have to protect individuals.
We must protect individual identity. So, effective, robust anonymization techniques are essential. This means ensuring datasets are large enough, stripping out unique identifiers, maybe adding statistical noise, basically doing everything possible to prevent re-identification while still allowing the aggregated data to be used for improving the algorithms.
It's a balancing act.
It's a critical balancing act. And if we connect this back to the bigger picture, these standards, consent, transparency, anonymization, they aren't just bureaucratic hurdles, they are the very foundation upon which trust is built.
And trust enables the data flow.
Exactly. That trust enables the continuous, essential flow of data needed for these models to learn, adapt, and ultimately become more effective at saving lives and achieving population health goals.
Which brings us full circle, really, to that boundary between the machine and the human. We have to remember the fundamental constraint that the sources insist upon. AI must assist, not replace, human empathy.
That's the core message, I think.
It returns us to the heart of medicine itself, that connection between one person who is suffering and another person dedicated to easing that suffering. The philosophical takeaway from this material is profound and really worth reflecting on. AI can diagnose with stunning speed and accuracy, but, well, the sources argue only compassion can truly heal.
That distinction is paramount, isn't it? Particularly as technology handles more and more of the clinical heavy lifting. The tech can provide the optimal treatment pathway, the earliest possible detection, the most precise diagnostic guidance. It removes guesswork, it removes administrative drag.
So what's left for the doctor?
The doctor's role shifts, it evolves. They move perhaps from being the overworked data processor to becoming the compassionate guide, the interpreter of complex risk information for the patient, the source of emotional reassurance when someone is scared or confused.
The human touch.
The human touch, that sense of being truly healed, truly cared for, is delivered by the human element, the conversation, the eye contact, the reassurance, the personalized psychological support. The art of medicine, as they say, is defined by that connection, empathy, and service. The sources strongly argue that AI gives doctors time back by handling the tedious stuff.
And that time must be reinvested.
It must be consciously and ethically reinvested directly into the patient relationship, into that human connection.
Wow. We've covered a tremendous amount of ground today. We've tracked AI's transition from a high-tech novelty to an indispensable clinical assistant, a powerful predictive engine, and even a genuine access equalizer across these global medical deserts.
It's a huge landscape.
It really is. So to try and summarize the sort of profound philosophies we've extracted from this source material, it feels like there are three defining pillars for the future of truly equitable and effective healthcare. First, technology must accelerate medicine. It provides the speed, the precision, the endurance that human capacity alone just can't sustainably match.
Right, that's the engine. A second, ethics must humanize it. This means that necessary technological acceleration is strictly bound by those non-negotiables we discussed: consent, transparency, data sanctity. That preserves public trust and individual autonomy, which are, as we said, the lifeblood of this whole data-driven system.
Absolutely. And third, the highest calling for healthcare, especially when using these powerful new tools, is that it must seamlessly combine science, soul, and service. Science gives us the diagnosis and the treatment plan. Soul provides the empathy, the reassurance. And service ensures these life-saving benefits actually reach everyone, regardless of geography or socioeconomic status.
Yeah. We've spent time detailing the incredible potential, haven't we? We talked about AI detecting those early lung cancer signs in 17 patients overnight in Lahore. We talked about the revolutionary potential to spot pervasive health issues like malnutrition and anemia from just a single mobile image in the remotest rural clinics. We know AI is capable of personalizing prevention and scaling diagnosis across these vast global medical deserts.
The potential is undeniable.
It is. And this leaves us with a critical final thought for you, the listener, to consider based on the trajectory laid out in these sources. It's a big question, I think.
What's that?
If we are investing immense resources, time, and ingenuity into scaling these incredible technological benefits, scaling diagnostic speed, scaling accessibility, scaling data analysis, how can we truly ensure that we equally prioritize scaling human empathy? How do we make sure that the immense life-saving benefits of this sophisticated technology are always delivered with the necessary soul and with dedicated service? That, to me, remains the ultimate challenge to the humanity of medicine in this coming age of algorithms.